5 years after the first COVID-19 lockdown gripped the nation, a sobering assessment reveals the UK's underwhelming performance in the face of the pandemic, despite significant financial investment. While the nation prepares to mark the anniversary this Sunday with numerous commemorative events, the lingering shadow of the virus continues to cast a pall, disproportionately affecting the most vulnerable segments of society. This isn't simply a matter of historical reflection. The consequences of inadequate pandemic preparedness resonate deeply within the fabric of British society today. An analysis of international data paints a stark picture. The UK's response, compared to other developed nations, lags significantly across several crucial indicators. Life expectancy, already a source of concern pre-pandemic, has further declined, revealing a vulnerability that COVID-19 mercilessly exploited. The already alarming rates of homelessness have been exacerbated, pushing more individuals into precarious situations with limited access to healthcare and support systems. Perhaps most alarming is the devastating impact on young people's mental health, a silent crisis unfolding amidst the pandemic's wake, leaving a generation scarred by isolation, uncertainty, and grief. The numbers themselves tell a story of missed opportunities and systemic failings. The UK boasts the sixth highest reported number of COVID-19 fatalities, a staggering 232,000 lives lost according to the World Health Organization. While the excess mortality rate aligns with other nations, this offers little solace. The sheer scale of loss underlines the gravity of the situation and underscores the urgency for a thorough examination of the UK's response. The discrepancies between the UK's performance and that of other comparable nations are striking. The argument that differences in data collection methods obfuscate a clear comparison holds limited weight. The fundamental issue, according to health experts, points to a long-standing problem: chronic underfunding of the National Health Service, NHS. Years of austerity measures have left the NHS chronically under-resourced and ill-equipped to handle the unprecedented strain imposed by the pandemic. This isn't merely a matter of hindsight. Paul Johnson, the director of the Institute for Fiscal Studies, offers a compelling perspective. Broadly speaking, we actually spent more and borrowed more than almost any other country. We were in that sense particularly generous. We increased our borrowing and debt by more than most other countries over that period. The paradox is stark. Despite significant financial investment, the outcomes remain disappointingly subpar. This suggests a fundamental problem, not with the level of funding, but with its allocation and utilization. The question remains, where did the money go, and why did it fail to yield better results? Sunday's Day of Reflection offers a poignant moment of remembrance and reflection. A procession along the National COVID-19 Memorial Wall by the Thames will serve as a stark reminder of the human cost. Services at St. Paul's Cathedral, Westminster Abbey, and the National Memorial Arboretum will provide spaces for mourning and contemplation. These solemn events serve as a powerful prelude to the upcoming COVID-19 inquiry. Later this week, the inquiry will delve into the critical early stages of the pandemic, examining the government's procurement strategies. Former ministers Michael Gove, Steve Barclay, and Helen Whatley will face intense scrutiny, providing crucial testimony on the procurement of personal protective equipment, PPE, ventilators, and oxygen. Their accounts will offer insights into decision-making processes, supply chain vulnerabilities, and potential failures in oversight. This inquiry represents a critical opportunity to understand the systemic failures that contributed to the UK's inadequate pandemic response. The pandemic's legacy extends far beyond the immediate death toll. The long-term consequences ripple through society, impacting individuals and communities in profound ways. The economic fallout, the strain on healthcare systems, the mental health crisis, and the widening social inequalities are just some of the long shadows cast by COVID-19. The UK's response, while financially substantial, failed to adequately address these challenges, raising crucial questions about strategic planning, resource allocation, and the resilience of national infrastructure. The upcoming inquiry provides an essential forum for accountability and a vital step towards learning from past mistakes. But true progress requires more than just identifying failings. It demands a fundamental reassessment of priorities, a commitment to strengthening healthcare systems, and a concerted effort to address the systemic inequalities that were so brutally exposed by the pandemic. The fifth anniversary of the first lockdown should not simply be a moment of remembrance. It must serve as a catalyst for transformative change, ensuring that future crises are met with greater preparedness, more effective strategies, and a stronger commitment to protecting the most vulnerable members of society. The lives lost demand nothing less.